All right, my watch shows 12:15, so we'll go ahead and get started. Good afternoon, everyone, and thank you for joining us for today's presentation by Jacqueline Curnick. She will be speaking to us today on the coronavirus response in South Africa. I am Megan Phillips, your ICFRC interim co-director and host for today's program. As always, we thank our members, volunteers, and interns for making these forums possible. All right, my watch shows 12:15, so we'll go ahead and get started. Sorry about that, 1 second. Good afternoon, everyone, and thank you for joining us for today's presentation by Jacqueline Curnick. She will be speaking to us today on the coronavirus response in South Africa. I am Megan Phillips, your We've got an echo. Okay, there we go. Okay. I want to acknowledge our university and community sponsors and supporters, the University of Iowa's international programs, the University of Iowa's honors program, the University of Iowa Public Policy Center, and the Stanley UI Foundation Support Organization for their financial support. I also thank today's special sponsor, which was an anonymous donation in honor of our beloved previous director, Ed Zastro. I also thank City Channel 4 for helping us continue to make our programs available to online audiences. Today, we have yet another online program. Following our speaker's presentation at about 1 p.m., we will have a 15-minute Q&A. Please submit your questions via the chat function on Zoom, which you can access by clicking on the chat box icon at the bottom of the screen. Our speaker will answer questions submitted by that chat. And for those of you watching on Facebook, you can also submit your questions via comment, and we will do our best to monitor these as well. As a final reminder, I ask that you please keep your audio and video turned off for the duration of the presentation and do not interrupt the speaker. If you experience technical difficulties, please refer to support.zoom.us for user guides and other support. With that, I will now introduce Jacqueline Curnick. Jacqueline holds a Master of Sustainable Development Practice with a graduate certificate in African Studies from the University of Florida. Her professional work lies at the intersection of community development, environmental health, and communications. In 2015, she was awarded a Fulbright grant to work in an at-risk high school in the Eastern Cape of South Africa. Since then, she has continued relationships with this country and community. Jackie currently works at a UI College of Public Health, where she coordinates the Community Engagement Core of the Environmental Health Sciences Research Center and is a member of the CPH Global Public Health Committee. As projections and fears rise about how COVID-19 will impact sub-Saharan Africa, South Africa has instituted an early and strict lockdown. This presentation will examine the current public health situation in South Africa, the government response, and how the virus is being managed. Additionally, we will discuss the debate around the continued lockdown in the country and how it will impact the already fragile economy and health infrastructure. Please welcome me in joining Jacqueline Curnick. So Jackie, I am going to enable screen sharing for you, and then it is all yours.
Great. Should I turn on my video as well or no?
I will leave that up to you. All right, you should be good to go there.
Awesome. Hi, everyone. My name is Jackie, and thank you so much for that introduction. And thank you to the Iowa City Foreign Relations Council for helping prepare this presentation and allowing me to talk. So I am going to talk about the coronavirus response in South Africa. I am not a professional public health official in South Africa, so a lot of my research is just by following the news very closely and using the information that I have about the country. As was a little bit alluded to in my bio, I have lived in South Africa for about a year in 2015 when I lived in the Eastern Cape, and I worked in a high school with the Fulbright grant. And then I actually married a South African we met while I was there. And so I have continued relationships in the country, and I was just there in December. So I think that I have a general idea of what's going on. I would love to share that with you. So the presentation will be talking first about the context of South Africa's challenges and really understanding why they have taken such an aggressive approach to stopping the spread of coronavirus. as well as some current info about the public health outbreak, information about the lockdown, and then we'll also focus on the latest hotspot, which is Cape Town, which is a recent transition. It was in the Gauteng province in the Joburg and Pretoria area, but now cases have surged there. And then we will talk about the economy as well as leadership and reactions from South Africans. I want to say hi to Zota, who is one of my friends that helped me with this presentation, and she's, I think, logged on from South Africa. So some development information. My background is in development, so I kind of like to start here. It has 57 million people in South Africa, and about half of the population of adults is under the upper bounds of the poverty line. So there are a lot of people living, day to day, hand to mouth, and it is one of the most top 5 unequal countries in the world. That is determined by a coefficient called the Gini coefficient, and it measures the wealth distribution. And so at a 0.63, when you get to, as you get closer to 1, that means that it's more unequal. And South Africa was at 0.63. The US is at about a 0.4. So there's a difference there. And then they also really struggle with a lot of gender and domestic violence in South Africa, which is fueled by a lot of things, but alcohol is part of that. And we'll go into that a little bit later. And currently, South Africa has the highest number of COVID-19 cases in Africa. There are lots of factors into that, whether it's testing and the amount of travel that South Africa has with other parts of the world. So that doesn't necessarily mean that, it has the truest number of cases in Africa, but that's kind of where we start. So this is an image in the Johannesburg area. I think this is Alexandria Township over on the right. And then on the left is what they might call a suburb or a non-township location. And this really shows the drastic inequality in South Africa. And it basically has led to kind of 2 worlds. You have, maybe one world where you might say a traditional third world developing country, and then you have a minority of people that are living, very well off, but they do have a majority of the area, a majority of the land. And so here on the right, you have a very high population density compared to other areas. And so these areas of high concentration are called townships or locations. And about a quarter of South Africans live in these specific areas. They're a legacy of apartheid, and they, during apartheid, which lasted from the mid 1900s until 1994, Black and colored people had to live in specific areas, and these areas were far from city center. They were had been removed from their previous homes, and they had been put into very high density, poor areas. So many families live in one room. There's a lot of people in small spaces. They don't always have indoor plumbing or water or electricity. But it's also important to note that there are townships that have developed as the country has developed. Soweto in Johannesburg is a very famous one. There might be million-rand houses in this area because as Black families, accumulated wealth and were able to, kind of overcome after apartheid, they sometimes still wanted to stay in these areas where all of their family and friends were. So townships are not uniform by any means, but overall, not a good public health area to be. And this is kind of contrasted with suburbs, as they call it. And they're, areas where usually, white families had lived during apartheid, and now there is a little bit more interracial, living there, but still very majority white and rich. And so they're very walled off. Almost every house in South Africa in this kind of area would have a tall fence, a 10-foot fence. And so they're very easy to isolate in contrast to townships. Something that I learned when I was doing this presentation that I think is really interesting is that actually these idea of townships and these separate areas started with the epidemic. So according to Howard Phillips, who is a leading historian in South Africa and focused on epidemics, he works at the University of Cape Town. He explained that in 1904, during the pneumonic plague, that is kind of the excuse that the white South Africans used to forcibly remove Black and colored people from their neighborhoods. And so they were considered a public health risk. So they moved people out of their homes in the city center into this area that's now known as the township of Soweto. So they did this kind of for the epidemic, and then after the epidemic ended, Indians, as they were classified, people from India, were allowed to come back into the city center, but the African Black people were not, and they had to stay in this area. And then in 1918, during the Spanish flu, they created even more of these satellite settlements, even farther from the city center. So there's a lot of geographic isolation, and I, assumed that it's part of apartheid, and it was kind of the groundwork for apartheid, but it started with a public health crisis. Another thing to note that was from this article, an NPR article, was that because of this very separate, way apartheid means separate, way that the country is still structured to this day, they're expecting a kind of double wave of coronavirus cases. And so they've seen the original cases coming from people that had traveled to other parts of the US, or not US, other parts of the world, such as Europe or China. But they're kind of expecting, as the virus takes hold in these poorer township areas, that there will be another wave. And this is not usual for most countries. So here are the number of cases in South Africa. And the good news is that they're doing pretty well. Their cases have maintained pretty low compared to what the original worries were. So as of yesterday, this was on 4/29, there were 5,350 cases in South Africa. And here's kind of the trajectory. These are the cumulative number. And then the daily number of cases, it stayed relatively, it's not as exponential as people were worried about. And that's partly due to the lockdown and other public health measures that have been taken. So currently, as I said, there are 5,350 cases, only 103 deaths, and they have had almost 200,000 tests conducted, 197,000 tests. And if you look at the case count here by province, so Gauteng is the area that has Joburg and Pretoria, which are, South Africa technically has 3 capitals, so that's one of the capital areas. And they have 1,400 cases. The Western Cape, where Cape Town is now surged as the top at 2,135 cases. KwaZulu-Natal, which has the city of Durban, has 956 cases. The Eastern Cape, where I lived, 630 cases, and then it goes down. Free State, 113. Limpopo 2, Northwest 29, Mpumalanga 31, and then Northern Cape is 17. Northwest is right here. So they've done a very large number of tests in South Africa, and that's definitely something that has been praised in the response. So part of the reason that they have such an aggressive approach is that South Africa is no stranger to epidemics and pandemics. They have currently about 1/5 of all of the HIV and tuberculosis cases are in South Africa. And so you have a large portion of the country with a compromised immune system, respiratory issues, and the country as a whole has a lot of trauma from experiencing these massive losses. 2 presidents ago, I believe, currently we have Cyril Ramaphosa, then we had Jacob Zuma, and before that, I think Thabo Mbeki. He has been kind of known as the crazy president. And so in the early 2000s, maybe late 1990s, He believed that HIV, sorry, that's an error there. HIV treatments were poisonous, so the antiretrovirals he did not trust them. And so because of that, there was a lot of misinformation about AIDS and AIDS denial in the country. Studies have estimated that 300,000 people have died specifically from misinformation about AIDS. There are 8 million people in South Africa that are currently HIV positive, and more than 2 million are not on any antiretrovirals or medicine. And so this has the highest world HIV burden. And this is one reason that they're so proactive about a lockdown. Just wanted to kind of give some context. George Bush's President Emergency Plan for AIDS Relief, the PEPFAR program, was actually incredibly helpful in the HIV epidemic. And it got more than 14 million people on in Africa on the antiretroviral medicine. When that program started, there were less than 50,000 people on this program. And so the reason that's relevant is because community health workers that are on the ground from that program are still there, and they are now being used in the COVID-19 response. And then also Ebola was an epidemic that happened in 2014 and 2015 that the country has been dealing with. So they have a lot of infrastructure around how to deal with pandemics. And so that's kind of what I discussed, the community health worker aspect. Right now, the country has 35,000 community health workers, and that's sponsored by the government as well as PEPFAR. And some of these workers have actually been working in their communities for 10 years already. So this is, a program that is not necessarily brand new, and they're able to use that momentum to really mobilize. They've set up clinics in poor communities that I had discussed. And so about 2 million South Africans have been screened. And so, they've been screened, and then of that were necessary to test, they have conducted almost 200,000 tests. And so far, this is the only country to do this type of screening on a nationwide in every province. Some other countries like Ethiopia and China have done screening, but not at this level. And so South Africa is very proud of that. So here is kind of a quote from one of the experts, and he's a member of the COVID-19 task force. He was describing it as screen, test, diagnose, contact trace, isolate, treat. It's the same basic elements for HIV, TB, and COVID. The only trouble with COVID is that we don't have a treatment. And so they're using the same approaches that they've used to tackle the other pandemics. Hold on. I'm having a lag here. Okay, so another example of this that I thought was really interesting and wanted to share was that South Africa has been an innovator. They actually were the first country to ever do a heart transplant. And so they have a pretty good medical system, a very innovative medical community. And so something that they did was designed this, it's called an Intubox. And it over here on the left, you can see it's basically a plexiglass box that would have a patient inside. And then they can stick their hands in and operate. And the idea is that it will protect the workers from any spray or, any of the virus. And this was designed kind of similarly to the Ebola cubes that were implemented during the Ebola crisis. And so a South African medical team had come up with this innovation, and then they outsourced it to a company to produce. And within 2 weeks, they were actually able to get the product into hospitals, and they're using it now. And some American companies are interested in using this technology. Another interesting aspect of the response is that Cuba has been sending health professionals. Cuba has sent over 1,000 doctors to 22 countries, and about 200 of those doctors arrived in South Africa recently, and they're being deployed in the Western Cape as well as in Joburg to help fight the epidemic. And so part of this success is that they have had a very strict lockdown in South Africa. It started on March 27th, and it was originally supposed to be 21 days, but it has been extended and it is still in effect. Um, they are currently at a level 5 lockdown. South Africa loves to do levels. They also do levels for when they take their electricity out, called load shedding. But so they're currently at the top level, which is a 5, but tomorrow they're set to go to a level 4. So they're going to ease some of the lockdown restrictions. And I'll talk more about that in coming slides. But they basically started this before a single COVID-19 death had even occurred. So they were really proactive. It says you cannot leave your home, not even for exercise. You can go to the grocery store, but there's a lot of long lines, and because the stores are limiting the customers, they're also only selling essential goods. So they weren't selling clothes. And my in-laws own a hardware store in a rural area, and they were not open. So if you were to operate, I know a plumber who's operating now, for emergencies, you need to be officially approved to operate and have a letter, because there are checkpoints throughout the country where people are checking to see if you should be out. There's no sale of alcohol or cigarettes, which is kind of, it's very interesting, and we'll talk a little bit about that. But it's a little shocking because I think this was announced like one day before it was instituted, and South Africans really drink a lot, and they smoke a lot. So I think people are upset, but it has had some very positive public health impacts. And so to enforce this, they have used the police and the military to enforce these rules. There's been reports of people using rubber bullets and tear gas to disperse crowds. And there's even been allegations of rape and murder by some of these forces. So it's interesting because of South Africa's history of being somewhat of an authoritarian state. I think that the fact that they're able to implement this, but it's kind of intense, is an interesting facet of it. So here is a picture of some of the South African National Defense Forces. So they're patrolling the township of Alexandra, which is in Joburg, and enforcing the, pushing residents inside. So the no sale of alcohol is really interesting, partly because South Africa has the 5th highest consumption rate in the world. They also have a very high fetal alcohol syndrome rate. In the Western Cape, it's common to pay workers with wine from the wineries, and so it's a big change for them. But the reason that they chose to do this was that the government wanted to prevent fights, domestic violence, and drunk driving. And it was intended to save hospital beds for COVID-19 people. So usually every week there are 34,000 trauma emergency visits to the hospital, and 40% of those are estimated to be alcohol related. And so the idea is that if we don't sell alcohol, whether that is at a bottle store or in local bars called shebeens, that people will not be gathering, they will not be fighting, they will stay and be enforced that lockdown. And so they have seen positive aspects of this, that there has been a decline. So it went from 34,000 trauma visits to 12,000 trauma visits per week. And they've also seen a decrease in crime. So this is going to be continued in phase 4, which starts tomorrow. So people are wondering if they were going to lift the ban, but alcohol still will not be sold as of tomorrow, and cigarettes. Cigarettes, the reason I think that they banned cigarettes were because it, compromises your respiratory system. And with so many people already, at risk, they didn't want to do anything to add to that. I still think that that's kind of amazing given the US context. I can't imagine the US just stopping selling cigarettes. So these are the phases that I had discussed of lockdown. And so currently we're in alert 5. They're saying they're using drastic measures. Alert 4 would be extreme precautions. And so, they haven't actually implemented level 3 or 2 or 1 yet. And they, as it says here, they will review this based on the rates of infection around the country. So what does level 4 mean? It means that you are now allowed to cycle and walk. You have to stay within 5 kilometers of your house, and it can only be between 6 and 9 a.m. So some people I've talked to are a little worried because now everyone that can leave, all is leaving within the same amount of time. So that's worrisome. They're also making it mandatory to have cloth masks, and no one can leave between 8 p.m. and 5 a.m. As we said, alcohol is not allowed, recreational visits aren't allowed, they can't travel between, between provinces. And one big thing is that the agricultural products will be allowed to be exported. That I think is a change, and that's important because the economy has been really suffering. And also winter clothes are being sold. And that, as I said, clothes weren't being sold, they weren't essential goods, but we are transitioning into the winter months, and there's not central heating in a lot of places. So people were really worried about that, and also worried about how the winter months will impact the virus. So currently we see a spike in the Western Cape. So when I was following this in preparation for the talk, it was Gauteng was, the center, which is a province. And now the Western Cape province has overtaken it. That was on 4/23 is when it kind of shifted. And yesterday from the 28th to the 29th, the Western Cape saw the largest increase of cases, daily cases that they had seen. So from 133 daily cases to 264 the next day. But the Western Cape says that it's, partly because of the screening. They're doing a lot of community screening, and so they expect to see a rise in confirmed cases because they're doing a rise in testing. There is, most of the cases are in the Cape Town area, which has, the biggest population density, but there is a area outside of Cape Town called Witzenberg. Maybe it's Witzenberg, the South Africans would say. And they're linking this partly to bushfires that have happened in the area. And so they've had to have a lot of essential workers fighting the bushfires. But because of that, they're seeing an outbreak. And so looking more specifically at Cape Town, this is from the NPR article I mentioned earlier, some photos. And this quote I liked. It said, "Driving from one neighborhood to another can be a jarring experience at the best of times. But since the countries went into lockdown in late March, the city's social divisions have been brought into sharper focus than ever," which I think is very true. There's a very big difference between being able to isolate in a informal settlement or township versus these kind of luxury, posh places in Cape Town. And so, as I had said, there's limited, refrigeration. There's you're not able to actually isolate with so many people in one room. You're sharing communal toilets. There's been also reports of people that have to service those toilets, the communal toilets, and those sanitation workers don't even have proper gloves or masks or even cleaning supplies to do that. But as I said, this very separated geography may have helped slow the spread, but they're still kind of expecting another wave to hit. So the response of the provincial government and in the Western Cape area, they're going to be using phone data to trace coronavirus contacts. Apparently the city of Cape Town has evicted families from informal settlements, and so now they don't have shelter, but they have opened homeless camps. And so they're basically fenced in enclosures that are guarded by security guards. And it's supposed to be countering the virus, but people are worried that it's actually going to be a breeding ground for an outbreak. They haven't been doing proper testing as people are entering that area. And so, thinking about the economy and what this means. I didn't I didn't focus as much on the economy, but there are certain aspects. There's what happened before the outbreak, and so before the outbreak, the economy has not been doing great for the last many years. Currently, unemployment is at an 11-year high, and so things have been deteriorating for several years. But the credit rating of Moody's sovereign credit rating has been downgraded to junk, which means that internal or international lenders are looking at South Africa's credit rating and thinking that they cannot pay back any loans. It makes it harder to get certain development grants. And so this has been on the decline for a while. I remember last year and even in 2015, they were talking about the kind of gradual downgrade every time. And so the unemployment in 2019, sorry guys, that says 2009, in 2019 was 29.1%. And so that's, I mean, a huge amount of people. It's 16.4 million people were unemployed in a country of 57 million. And this is an 11-year high. And so the country was already in a recession before this happened. They also, like a lot of African and other developing countries, they have a large informal economy, and that's estimated to have 3 million jobs in it. And so people are very concerned that when economic issues are being addressed, that the informal economy will be left behind. And so those numbers are even, worse than what is being reported. An example of just kind of the general issue is that the country's largest airline, South African Airways, shut down, and they were already kind of on their last leg, but this disruption to travel has ruined that for them. And so overall, the country's economy will probably shrink by 6.1% for the year of 2020. And sectors such as construction and retail are operating at below 20% capacity. So the shutdown is not good for the economy, as we know. And, this is just sort of the story that we hear all over the world. How do you rectify and fix an economy when there's a public health crisis that, basically mandates that we keep our distance? So an economic relief package has been, put forward by the president and the administration. And so this package will be 500 billion rand, which is 26 billion US dollars. So it's a lot of money. It's about 10% of the GDP. And this is on par with what a lot of international countries have been doing. You see bailouts between 10 to 20% of their GDP. And so this was announced relatively recently on 4/21. And so before that, there were lots of calls and people were very worried about the economy. So this is supposed to be assuaging some fears. The way that they have planned to pay for it, if you see here this graphic, they're going to take 130 billion rand from the existing budget and reallocate it. And then the rest, they haven't specified exactly how it will be, supported, but we have, they say that they will have international finance institutions and global partners, but they haven't specified. So 200 billion of these rands will be guaranteeing banks so that they can continue to lend. They will use 100 billion to protect and create jobs, 50 billion for welfare grants specifically to poor and unemployed. And within the next 2 weeks, they are doing 250,000 food parcels, directly delivered in food aid. So you can kind of see here in this graph, we have municipalities or some other organizations, as well as small businesses and tax relief. So this, economic package was put forward by President Cyril Ramaphosa, and this has been a generally good time for him. People have a positive view of how he's handling it. Both in South Africa and other countries, other African leaders, and the African Union have been supportive of how he has handled it. People have noted that he's consulted stakeholders and taking very swift public health measures, as we've discussed. But I would like to note that South Africa has a history of corruption, and I just saw an article today that some people are calling into question the amount of leadership that is making these decisions, and there's always kind of a debate about that. It's interesting because I would say before this, Cyril Ramaphosa was not necessarily a popular president, and so there are some statistics to back that up. A poll that was conducted, this was conducted between April 15th and 23rd, it was polling the approval of various leaders, and I focused on President Ramaphosa. And so I just wanted to say I copied this from the article, and so they use the phrase minorities, and I believe what they're referring to is the minority share of races in the country, which is white, colored, Indians, and others. And so white South Africans make up about 8% of the country. Colored South Africans make up about 10%. I think Indian is a little lower. And so Black Africans make up 80%. And so that's relevant to this information, because the poll found that overall 67% of respondents strongly approved of the president's handling of the epidemic. Only 7% strongly disapproved. Black respondents gave Ramaphosa a 65% approval rating, and among minorities, he scored 73%. So he's doing better among minorities than Black South Africans. And this is very interesting to me, because if you look back a year ago in April 2019, he only had a 37% approval rating, and this was 45% among Black South Africans and just 10% approval among minorities. So I think that's very, very interesting. And I've seen this anecdotally on my own. This is a white person that I know, and he has been really supportive of Cyril. And when I talked to him in December, I didn't get that feeling that he was not that supportive of the ANC, which is the party that Cyril is part of. And so this Facebook thing says, I want to vote for Cyril, no party, just Cyril. You see the comments, thank goodness. I agree, he's great, but don't forget the past. As I had said, he was not super popular, even maybe a couple months ago. So I found that to be interesting. And then a quote from my friend Zota about this as well. She says, our current president has shown above average leadership through this period. He has consulted with every single stakeholder in the country and listened to advice and concerns, and has made decisions based on fact and research. We feel heard, and that's one of the reasons everyone has adhered to the regulations. So I wanted to kind of talk about President Cyril, but then also just kind of the general reactions. And so Zota gave me some other quotes. And so I know Zota through our Master's of Development Practice at the University of Florida, and she was an international student and got her degree there as well with me. And so right now she is a consultant for an organization called Trialogue, and they do corporate responsibility. So they've also been working in this area of how corporations are dealing with COVID-19 and corporate social responsibility. So she said, one crazy thing is the realization that South Africa is capable of service delivery, and that it took a pandemic for government to innovate, to spend where necessary, to support local business, to use intellectual resources to inform policy, and to be practical about it. And I think that's very insightful, because from anecdotally, one of the biggest complaints I hear is that the government was not doing anything before the pandemic. There were a lot of people in poverty, a lot of economic issues, and some missing money. People were just like, we're not seeing any results from the, things that were supposed to be implemented. So the actual service delivery, and related to that is Eskom, which is the country's energy provider. As I had said, they have had phase outs of energy where it's called load shedding. And so large parts of the country may not have power for 6 hours a day, 8 hours a day, 12 hours a day. And so the idea that they're actually delivering services is really shocking to South Africans. And then the other aspect is just, the emotional aspect of isolation that we're all dealing with. And she said, emotionally, it has thrown a curveball. we just didn't expect. As a Black South African community, it is key that we thrive when we're able to visit everyone, roam the streets, hang around, and go window shopping in the big shopping malls. And so anxiety has creeped in, but we're learning to deal with it. And then another friend and colleague that I know is Jade Bauer. She is in the Eastern Cape and works in an organization called Early Inspiration. And they focus on early childhood education, and they work primarily in township areas. And they train, what their organization does is train preschool teachers and early educators so that, you know, kids in the townships will have access to early education. And so she said, COVID has placed a lot of focus on South Africa's most vulnerable, which is its underprivileged citizens. I think going forward, I am hoping this will improve the inequality of resources. So I wanted to end there just because I think that a lot of people in South Africa are doing, you know, they're coping with the lockdown, but they're also trying to keep in perspective that they usually, you know, people that I know a lot of times have access to resources. They are not the worst off. And so balancing all of that into perspective when you have such a large part of the country that is really at risk for hunger and starvation, as well as getting the virus, I think is important. So with that, I'll go to my last slide. Questions. Thank you.
Okay, perfect. Thank you so much, Jackie. That was really, really interesting. Excuse me. Now we will move on to the Q&A part of the program. So please submit your questions via the chat function, which you can access by clicking on the chat box at the bottom of the Zoom screen. You can type your message there and we will field questions from there as they come in. For those of you watching on Facebook, you can leave questions in the comments and I will do my best to monitor those as well. While we wait for questions to come in, I would just like to mention that we do have some more upcoming programs in the process of being organized, and since we don't have details for those yet, we will be sending out our email announcements as usual, and also you can check our website for the latest updates on programs. Additionally, we would just like to take a moment to thank the members of our community and our ICFRC group who are working in healthcare, delivery, and other essential businesses and services. These are uncertain times, but the work provided by these members of our community is absolutely essential to our ability to continue thriving, so thank you very much. And then we will just see if any questions come in. I don't see any yet.
That's
Jackie,
okay.
yeah, keep an eye on your chat in case someone sends it just to you, but otherwise I will. Oh, I see one. So we have a question
Yeah.
from James here. So how do people who depend on daily earnings in informal economy cope with the lockdown?
That's a great question. I don't know if I entirely know the answer to that. I mean, there are local community organizations that are delivering food and kind of basic essentials. Um, I really don't know. I think that's one of the problems is that a lot of the information that is kind of coming out is about the overall picture. And, you know, they say people are really struggling, people are at risk for starvation, but I don't think that any of the direct funds, like it's not like the US where we have received, you know, a direct deposit or anything like that yet. So I think that they're, you know, borrowing from friends and neighbors. They're working as a community to kind of pool resources and, you know, share food, which is not unsimilar or dissimilar to what they would do, you know, sort of on a daily basis when they don't have a lot of money.
Okay. Since I don't see another question just yet, I have one of my own. How do you think, in your opinion, and also how you think that the people of South Africa see themselves as compared to other countries in the Southern Africa in dealing with this crisis? How do you think they compare?
I think South Africa is definitely proud of what they have accomplished, you know, by having a lockdown and having such strong support. I think I didn't include the statistic, but I think about 70 6% of people supported the lockdown. And so I think they're proud of that in some ways. At the very beginning of the lockdown, there was a general sense that they didn't really understand COVID-19 or the risks. And so people were not really kind of complying in a lot of areas, especially those kind of informal areas, to the lockdown where you really can't isolate yourself anyway. And they felt like it was just sort of for rich people or white people that might have left the country. But now they're sort of understanding, the need for everybody to take social distancing seriously. The other countries that have sort of responded to it, I'm thinking of Ethiopia. I think Angola has responded as well, but South Africa definitely has taken a lead.
Awesome.
Ooh.
Yeah, you can see the questions, so go ahead and you can, if you'd read them first, and then you can go ahead and answer them yourself.
Yes, I actually like both of these questions. So the first question said, what is the definition of colored? And I appreciate this question because that is kind of what I studied while I was in South Africa. I worked at a colored school, as they have defined it. And what happened during apartheid, South Africa basically classified each person. And so if a person, and at this point in the history, this is the 1950s or 1940s, and people had already been living together, white people, Black people, and this group called colored people, which originally started as the Cape Khoisan, which is a tribe in the Western Cape. And they were a specific tribe. They kind of had more, they had some Malaysian and other kind of influences. And so they were, not white, not Black. But then that kind of cultural, that specific lineage got a little bit more diluted as people in apartheid government just started classifying anybody as colored. So if your mom was Black and your dad was white, you might have been labeled as colored. However, under apartheid, that was not really allowed. Like interracial relationships were not allowed. And so then colored people kind of became their own group. And so a colored person could only be with a colored person. And so there's a very rich history of a lot of genetics kind of going into the colored community. And so you might have siblings that are one super fair and the other one is very dark, and maybe another one looks Indian or Asian. So it's a very diverse group. And it doesn't have that same, obviously in America, the term colored is a bad term. And, in South Africa, all of the labels of apartheid do have their own taboos, but people are generally happy to be called colored. That is their identity. A lot of times they speak Afrikaans, and they have their own accent and kind of their own cultural identity. So hopefully I answered that one. And then the other question was, has South Africa always had a strong relationship with Cuba, and has there been any aid from China? And that's interesting because yes, they have actually had a strong relationship with Cuba. In Port Elizabeth, where I live, there were lots of restaurants called like Castro's, and there I think is even a memorial where there was a partnership between Cuba and South Africa. I think that kind of goes back to the communism roots that took place. I'm not super familiar with it, but kind of during the end of apartheid and also in the 60s, when so many African countries were becoming independent, they did have some relationships with Russia and Cuba in that way. And has there been any aid from China? So I don't know specific facts and figures. I know that China has been using development, for a long time by putting in roads in South Africa and all over the continent, and providing other resources and kind of development money as a way to gain leverage in Africa. And they South African economy exports a lot of minerals to China, so they are tied. But I don't know what China has done in this specific coronavirus crisis. And one last thing about that is you may have heard reports, in China about Black people being kind of shunned and saying that they have the virus. And then also, I think instances in South Africa where people that are Asian or, even in the US are being targeted as well for having the virus.
All right, I actually have another question. I'm going to send it to you by chat.
How does the administration? So the question says, thinking of what you've said about polls and getting info about COVID-19 to people, how does the administration manage this differently between suburbs and townships? Is the method of getting information out to people different for these areas and demographics? I would say yes. I would say that, and I can't be sure, but I would say almost all of what I've read and seen about community health and this kind of mass mobilization has happened more in the townships and in the poorer areas. So I don't think that you would see maybe people going door to door in the suburbs in this, walled areas for people to be doing health screenings. And, that being said, people that usually live in those areas, they might have more access to go to a hospital or to a clinic to receive care if they are sick. So I think that a lot of the information and targeting has been in these areas already, and that's also where they have community health workers that already were existing.
Okay, great. I am not seeing any questions on Facebook, so if nothing else comes in, we can go ahead and wrap this up. If you do have questions for Jackie in the future, you can always send them to us at our ICFRC@icfrc.org email, and we can get them to her. So with that, we will conclude our program. I want to give a big thank you to Jackie for the wonderful presentation. One more time, thank you to our sponsors for their generous support, and thank you to City Channel 4 for their assistance in making our programs viewable to online audiences. Jackie, I want to let you and our audience know that even though we are conducting virtual programs for the time being, you will still be receiving our coveted ICFRC coffee mug. We will just have to find a creative way to get it to you and all of our previous virtual speakers. Thank you again for presenting to us today virtually, and to our audience, thank you for joining us. We are adjourned.
Thank you.